how that might fit into clinical practice and the impact of a couple data points that we'll bring out. There's a lot of market data out there that despite conventional neuromodulators lasting kind of 3 months, 4 months, that average consumers only come in sort of 1.9 times a year or less. So first and foremost, we think it figures in very well to what the normal pattern is of consumers. Secondly, particularly with the prestige accounts that we're going after, when we've been out in the field, these folks, if anything, have long waiting lists. And so getting into these accounts is the challenge. And so if you're a provider, the only way that you can necessarily increase sort of the services that you offer to your patients or increase profitability is if you can do more services at the same setting. And a neuromodulator treatment every twice a year fits really well with also providing filler as well. So this idea that you can add sort of both filler and neurotoxins together to give better outcomes to patients and increase the per visit ticket makes a ton of sense. So in the customers that we're talking to, and obviously we've got a bias towards those that are leaning into the prestige strategy, it resonates a lot. The last thing I would say is, innovation for us underpins everything, but what that does also is creates more choice at the physician level and at the consumer level. And so with a longer acting neuromodulator, we're not trying to be everything to everybody. And so if there are consumers in the practice that prefer coming in 3-4 times a year, and that's the cadence that they want, the practice wants it, that's great. But based on our market research, we think there's a not insignificant number of consumers that really will put a premium on a neuromodulator that lasts longer. And so we think, practices being able to provide choice, figuring out what fits makes a lot of sense. So we continue to feel really good about the value proposition and how this is going to fit into practices, both from a consumer demand and from a profitability standpoint.
That's great to hear. Thank you for clarifying. And maybe my one follow-up. In the therapeutic category, I just don't understand why a long-duration product would not capture a majority of share eventually in an indication like cervical dystonia. I know you're obviously adding to the therapeutic side of your franchise with the addition of Rob, but can you maybe talk to some of the market research and remind us about the market research in the therapeutic side?
Sure, Tim. No, and I would say that's sort of what our market research shows as well. It actually shows that in the therapeutic area that we could become a shared leader. And I think it speaks to the fact that these are debilitating diseases, and that the ability to reduce the frequency of visits, obviously gives prolonged symptom relief, but it also takes some stress off of the system, right? It's less facility fee, physician time, and everything else. And so, if you look at the data that we generated from our CD program, not only was the duration profile really strong, but we had a very encouraging safety signal as well with low dysphagia rates. And so, we really are optimistic about our neuromodulator performance in clinical trials and therapeutics. And so, that's why we announced some of the new hires that we have. We're starting to get ready for commercial introduction of our, cervical dystonia indication, and feel very good about the performance profile of the product in the therapeutic market.
Thank you for the question.
Thanks, Tim.
Thank you. Our next question comes from the line of Balaji Prasad from Barclays. Your line is now open. Again, our next question comes from the line of Balaji Prasad. Your line is now open.
Hi, good afternoon, everyone. Thanks for the questions. Apologies if this has been asked before, but just want to go back to the number of accounts opened this quarter, 2,000, or net accounts opened, 2,000, and try to extrapolate this as to what's likely to be the account opening run rate by the end of the year, and how this could tie up to your eventual DAXI launch. Thanks.
Yeah, so thanks, Balaji. We've reported sort of the total number of combined accounts between our services platform and our products, which is the RHA product line, at the end of each quarter. So, we talked about there being, over 500 at the end of Q3, over 1,000 at the end of Q4, over 1,500 at the end of Q1, and now over 2,000 at the end of Q2. So we've been, averaging 500 or so new accounts adds per quarter. Obviously, with some of the new products and programs that we have coming out, we'll need to sort of look to say is account activation is important, is doubling back and making sure that with some of these new services that we're going deeper in the existing accounts. But I think those are reasonable numbers for now. I think post-approval of our neuromodulator, we'll need to revisit that because, again, our strategy is much more versus a deep versus wide. We clearly have a lot of run room in the accounts that we view to be our target market opportunity. But with this tracking right now, it's not unreasonable to sort of look at 500 new account adds per quarter as something that could continue to exist for the balance of the year.
Thanks, Mark. That's helpful. And maybe a quick one on biosimilar Botox to just see where you are post your resubmission or submission. Sorry, this is with regard to the FDA data package that was submitted a couple of months ago.
Oh, so on the biosimilar, what we indicated was that the next step in that program is to have a meeting with the agency to determine the phase 3 program that would be required for approval. We expect that to happen before year end. I know that Viatris has their own conference call coming up soon. They might give a little bit more commentary on it, but we continue to be encouraged by the dialogue that we've had with them. And again, there will be a meeting with the agency to lay out sort of what that program is going to look like before year end.
Got it. Thanks, Mark.
Great. Thank you.
Thank you. Our next question comes from the line of Serge Belanger from Needham & Company. Your line is now open.
Hey, good afternoon. Thanks for taking my questions. First one for Mark. Can you just give us a refresher of the open label safety study in cervical dystonia from which you'll be reporting results in the second half? If I recall, patients are eligible to receive multiple courses of treatment, so maybe just give us an idea of what you'll be looking for in terms of efficacy, duration, and safety.
Yeah, so on the open label safety study, it was really a dose escalation study looking at, primary endpoint there was to look at the safety of, sort of repeat doses over time. And so when we report that out, it's much more of a looking at the safety profile of the product and, how patients respond to, again, these different doses that occur over time and increase in doses if that's what the clinician ultimately decides. So it's less about sort of the duration profile and more about the safety side of it. So that's what we'll be reporting out on that.
Okay. And secondly, with the addition of Rob Bancroft to the therapeutics team, should we look at that as kind of a confirmation that you're moving forward with a commercialization effort for the muscle movement disorder in lieu of a commercial partnership?
Yeah, that's correct. In addition to Rob, we also announced last quarter the addition of, another senior level person on the healthcare reimbursement side of it, so that we're focusing on that as well. And so, we've long talked about our focus on building out, sort of a direct sales force in the muscle movement space. And, these are some of the key pieces that we're putting in place to allow us to access and enter that market. As it relates to cervical dystonia, we've talked about a filing in 22 and approval in 23, so it's not too far away. And we believe that there's a fair bit of opportunity to be unlocked there. And as we talked previously, we think that the performance profile of our product will allow us to be, very competitive in the therapeutic category.
Thank you.
Thank you. Our next question comes from the line of Ken Cacciatore from Cowen. Your line is now open.
How you doing, team? Congratulations. Just really great performance without yet having DAXI. So as we think forward, I know, Mark, you want to be thoughtful in terms of how the product is rolled out, the experience and the initial experience some of the kind of key users have. Can you